And welcome back. Well, epilepsy is a chronic disorder most associated with unprovoked seizures.
It can affect one's safety, it can affect a person's relationships, work, driving, and a lot of other things. And here to talk about using evidence-based medicine to treat seizures and epilepsy is Dr. George Morris with the Epilepsy and Seizure Care Specialist Group. Great to see you.
Yeah, good morning, Dr. Morris.
Thank you. Thank you for having me on.
To me, when I feel fortunate that I have not struggled with this disorder. I don't have children who have, but whenever you talk to us, or when I know of friends who have children with this, I just think about what a frustrating problem it must be, because it's the kind of thing that just hits people out of the blue and completely, I mean, it alters their life in those moments.
It does. It does. And those moments represent such a small fraction of their entire life, where otherwise they're functioning perfectly well. And if we can eliminate the seizures and not have to substitute that with some overwhelming side effect from medications, then we can actually have somebody who is absolutely functioning in a normal way.
How common are seizures?
Well, epilepsy is actually quite common. 1 in 100 people has epilepsy. It's as common as diabetes. Oh, well, it's as common as diabetes used to be. I think diabetes is starting to catch up, put some weight on there. But epilepsy is a very common 1 in 100 people. And many people will get seizures and not go on to have epilepsy. So we have about 1 in 10 people who during their life will get a seizure. And we have to differentiate those. We have to figure out which one is which. Are we dealing with somebody who's going to continue to have these or not? And then after we start treatment and we're not having any success, then why aren't we having success? And that's a point that so many people don't get to. That's where the breakdown seems to happen. We've tried this medicine and we've tried that medicine and there were problems with them, and we just don't move on to finding out what's next. And that next step evaluation has to then lead to an intervention, because people who continue to have seizures have higher death rates.
Yeah.
They have poor lifestyles. They don't finish school. They don't have jobs. Their quality of life is abysmal. And you can't give in to that. You can't say, okay, that's all I'm going to have, because that's not where we are.
Yeah.
Like that's not acceptable.
Not at all.
Right?
Not in the slightest.
We use this term evidence-based medicine and approach, and what are we talking about? Because it's almost, it reminds me of when we've talked before about depression and people who are treatment resistant. I mean, are we talking about, as it relates to epilepsy, people who seem sort of treatment resistant, or like it's just not working, and don't give up, but do what? Consult a different expert, get a different opinion?
Well, first of all, it's a third of people who develop epilepsy who become treatment resistant. So that's a very huge number.
It is.
And that's 1 million people or more in the United States. And what we've learned, based upon looking at studies that compare treatments, is that surgery in that setting is vastly superior to medicines, vastly superior.
Why don't people do it then?
People have misconceptions. Doctors have misconceptions.
Because are you going in the brain when you do surgery?
We go in the brain, that's where the seizures are.
So people are probably afraid of that, right?
Absolutely.
Yeah.
There's so many kinds of brain surgery where you have the vision of someone coming out of it as a vegetable.
Yeah.
Okay? No vegetables in what I do. Absolutely none. Doesn't happen. We have a low frequency of complications, and we have a huge number of functioning people, and a third of them wind up not actually taking medications afterwards, so they're cured.
So if someone does a surgery and afterward, will seizures likely go away, or could they still have episodes periodically?
Well, more than 2/3 of the people have absolutely no seizures after the surgery. And of those that remain, another 15%, another half of the remaining patients have a 90% reduction. So we're talking about
huge.
The number of seizures you have in a month now becomes the number you have in a year, which is you get back to driving, you get back to not having seizures when you're at work, so that the people at work are nervous and don't want to see you back in the workplace, or school.
Yeah.
I can't tell you the number of times we see people just, their lives just getting terminated, and they get stopped by the seizures, unfortunately, after they clearly could have already had the surgery, and the problem would be gone, and they never would have wound up hitting that roadblock.
Is the surgery, do people tend to recover quite well? Do they have a somewhat quick recovery? What's involved?
What I tell people is for a couple of weeks you're just going to feel really, really tired. Even thinking hard will make you tired, like physically tired. You'll fall asleep. But by the time we reach the end of the second month, most people are back at their workplace, doing all the normal things that they've done, or back doing things they couldn't do because they were off because of the seizures.
So can people have a consultation with you, or do they need a referral in order to be able to see you?
Our phone number, which they're going to show up on the screen in a little bit, is, you call me, we'll fix it.
I love
That's
that.
what when it's all done, no seizures, no problems. That's our goal.
You're really
that's
giving
the only
someone's
thing
life
that
back.
we should be doing, and that's what I've been doing here for 25 years in Milwaukee.
Yeah, I agree with Tiff. It's like,
giving
here's
them
your life back.
Yeah.
Yep.
Now you can enjoy something for the first time in a long time. Here's the information for Dr. George Morris. He's the medical director. Call him directly at 414-385-8688 for the epilepsy and seizure care specialists. Learn more about how to get your life back and really reduce that experience, or hopefully get rid of it altogether. Thanks so much for being here, Doctor. Nice conversation.
Thank you.
Yeah.
Thank you
Good to see
very
you.
much.
Appreciate it.
Thank you very